Welcome to the PD Pet Care Vlogs. I'm Dr. Cath Watson, and today we're going to cover luxating patellas, which is really just a fancy name for saying kneecap instability. Essentially it means that the kneecap is kind of dislocating, so it's moving, slipping in and out of place, or it might even be fixed completely out of place. So what exactly is a kneecap and what do we even need it for? So I say we because obviously we have kneecaps as well as dogs. It's in the same joint, the knee joint. Their knee is slightly different to ours because obviously it sits at a bent angle, unlike ours, which is very straight up and down. But the kneecap in both cases forms the same function. The kneecap is a wee piece of bone that sits buried within the tendon. And that tendon is the big tendon that pulls together our quadriceps muscles and runs over the front of our knee and then attaches to the top of the shin bone. So the function of the kneecap is actually to help that tendon, that massive tendon that's anchoring those big thigh muscles, is to help it glide over that joint because obviously it's going around a corner. And what should happen is that kneecap, that piece of bone, should actually sit in a groove in the front of your femur, so your thigh bone. As it goes over and around that corner, there's a couple of grooves there that the kneecap should run in if it's functioning properly. So what happens when it's not functioning properly is that instead of sitting in that groove, that kneecap usually slips out to the inside. Sometimes it'll go lateral, so to the outside of the leg, but most of the time, and particularly in most dogs that we see, it slips to the inside. Now, I said before that sometimes this can be a temporary thing, and we refer to it usually as a floating kneecap. And what happens is that certain things seem to trigger it to pop out or slide out over the ridge, and then it runs down the inside, taking a short track, rather than running over that groove. What do we normally see if that's happening? Well, in most cases it's not painful. So what you'll notice is a dog who's running along on 4 legs, then they pick up a back leg, run along on 3 legs, then they put it down again. Doesn't stop them running along, they don't turn and look at it, it doesn't appear to be painful to them, but they do hold it up. So sometimes if it's actually fixed out of place, then you'll see a limp because they can't functionally use that leg properly. By having that kneecap slip to the inside, the leg can't really bend and extend in a normal way. So the leg essentially ends up a wee bit shorter, which gives them the appearance of a limp or a skip. So running along on 3 legs, pick it up for a step or 2, put it down again. So they just seem to skip along the way. If both back legs are affected, then sometimes you'll see a bunny hopping gait. So because they can't really function properly, it's making them squat a little bit. So they'll hop along like a bunny with their back legs instead of a normal 1-2 gait. It's much more common to see a luxating patella in a small breed. So the likes of your chihuahuas, miniature poodles, foxies, shih tzus, but also your bow-legged dogs. So as far as the larger breed goes, much more likely to be seen in something like a staffy or a bull mastiff that's got a more bowed appearance in their back legs. So there is a degree of breed or genetics that make dogs more prone to ending up with these luxated patellas. Conformation definitely plays a big role, but also in some cases it can be trauma that causes it. So the kneecap is normally not only stabilised by running in these grooves, but also by some ligaments on either side. So if there's been some trauma to the knee joint that causes those ligaments to rupture, then the kneecap's much more likely to wobble around the place and fall out. With the breeds that are more likely to be affected, I've mentioned being bow-legged, so obviously having a big angle in the leg in the first place makes it a lot harder for that for those muscles in that tendon to travel in a straight line, much more likely to want to fall to the inside. And what can happen is that those grooves or the ridges of the groove don't form properly, so there's not enough of a barrier there to stop that kneecap from flicking in and out. Sometimes it's actually just the straight alignment of the joint, so the connection point is just too far to the inside compared to where those muscles run down the thigh. There are different grades of luxation, so anywhere from just the occasional slip in and out, so a low grade luxation, right up to the much higher grades, where at grade 4 we have a kneecap that is permanently in the wrong position. Even if we use our thumbs and try and push it back into place, it won't go, it's locked in position. So obviously dogs that have a kneecap locked in that inside channel rather than being in the normal position will have a much more squatted sort of gait because they can't straighten that leg properly. As far as the treatment goes, for dogs that are displaying any sign of pain with that joint, particularly when it's flicking in and out, that's going to need immediate attention because there's a good chance there's something else going on there. There may be a fracture or damage to the cartilage, or if it's been a traumatic event, then obviously ligaments torn. So you're going to need some pain relief as a minimum, but usually some form of surgical intervention to help fix that. For the lower grade luxations, so these are occasional or not really interfering with the dog's general ability to function in life, then maintaining a good weight is really, really important because obviously the more weight you have to carry, the more sedentary you are, the looser your ligaments tend to get, so the worse the problem is likely to get as well. The second thing is engaging with a physio or your veterinarian on some strengthening exercises to try and make sure that your dog stays physically capable, because luxating patellas can put that knee joint at risk of other injuries, particularly cruciate tears. So making sure that your dog has the physical strength and ability to deal with the activities that you would like them to be taking part in, obviously is a really good thing, much as it is for us. For the higher grades where the luxating patella is actually interfering with their ability to partake in normal doggy activities or is physically impairing their ability to exercise, or obviously causing any pain, then those will need surgical intervention. It really depends on what the underlying issue is as to what that surgery is. So it is best discussed with your veterinarian, and it may be anything from creating higher ridges, a deeper groove, moving the connection point so that it's more lateral and the leg functions in a much straighter direction. It may even mean realigning the bones by cutting them and fixing them back together. So there's a whole bunch of possibilities there, but for the vast majority of dogs, a luxating patella is not generally painful but shouldn't be ignored. So please, if you've got a dog that seems to be skipping, hopping, bunny jumping, all that sort of thing, please go and seek advice from your veterinarian as to what's the best course of action for your dog.